and Austria always played a very leading role in development and the history of medical developments. And I think, beside all the wonderful medical developments and advances we had in the last 2 centuries, I think e-health is a wonderful new instrument to advance the quality of treatment and the quality of the healthcare system. So we see it in the consequence, that's a consequence we would like to stress. And therefore, e-health conferences are a good example to demonstrate the quality and the success of our medical system.
أنا فاطمة عبد الله من مدينة دبي الطبية. My name is Fatima Abdullah, and I'm the Chief Strategy Officer for Dubai Healthcare City. Dubai Healthcare City is the first healthcare-free zone in the world, and by healthcare-free zone we mean that we aim at attracting and providing services to the nationals of the UAE and people who live there, as well as people who come from all over the world to Dubai, through a variety of healthcare providers from all over the world. Dubai Healthcare City's vision is to be the location of choice for quality healthcare services and an integrated center of excellence for medical education, wellness services, and research. And the core of what we do is providing quality care informed by medical education and research. So that's really what Dubai Healthcare City is. And it was created to meet a regional gap in quality healthcare. Many people in the Middle East are not happy with the healthcare system that is available to them, particularly in relation to the quality of care. And what we find is that a lot of people go overseas for various treatments, even though some of it is available in the UAE. So what we want to do is we want to capture the trust of the population and assure them that we're using the highest standards of care, and by bringing physicians from all over the world and nurses and other healthcare workers to provide care in Dubai.
If we actually want to make use of electronic health records, if we want to understand what they mean, if we actually want computers to understand what they mean and use them to help improve the quality and safety of care, then we need to ensure that computers and humans can easily interpret the kind of things that live in health records and the kind of things that live in the world of medical knowledge.
Okay, so I'm Richard McPartland from Tumas Technology, and here we have the first generation vital signs monitor, and we're monitoring ECG and temperature and also the patient ID, and streaming this data continuously over a short range ultra low power wireless link to this PDA here. And if I can just show you here that we're showing the dummies. The dummy has an electronic heart, and in fact so we can see his heart rate here, and then the data on the PDA is being synchronized over wireless LAN with a back-end server, and we've actually developed an end-to-end system together with Oracle, so it links into the Oracle's HL7 compliant HTTP database. So
as you mentioned, it's still not in the market.
It's not in the market. We will actually be using some of these modules in some clinical trials early next year for fetal heart rate monitoring. But what's much more interesting is we've now shrunk all this circuitry, put all the low power radio and the vital signs monitoring circuitry all on one chip. So we have a system, put this onto a system on chip.
What are the challenges that you mentioned?
Well, the key challenge has really been to get the power consumption right down, because there are a lot of wireless vital signs monitoring devices available today, but they usually have very large batteries, And because we can operate off very low power consumption, a factor of 10 or 100 times lower, we can use some very new, interesting type batteries. For example, this is a thin, flexible battery.
What kind of patients should get happy for this?
Okay, a wide range of patients, but for example, patients with chronic diseases, with long-term diseases, for example, like diabetes or COPD, we can monitor the vital signs of the patient, and we envisage that our system, using very small size digital plasters to monitor the vital signs of patients, will allow the earlier detection of what was called, the medical people call an adverse event. And also there's quite a lot of interesting work going on in predicting adverse events. So for example, for a diabetic it could be going hypo or hyperglycemic. We can help detect these situations earlier, because we're continually monitoring vital signs on the body. And also we're actually actively involved in an EU Framework 7 program to actually help predict some adverse events in advance, so that the patient can take action earlier and avoid.
About the prices, the last question.
The price?
Would it be
yeah.
So in the market, or would it come which would not be affordable?
Yeah, initially obviously it's going to be quite expensive, but we are targeting to get the cost right. We're getting the cost right down. So we're targeting to have a low-cost disposable model, sub $10. But this is obviously some years off before we can hit that kind of price point, and it obviously means we've got to get the volumes right up.
Thank you very much.
You're very welcome.
And be able to interpret these together, because unless we can interpret them together, we cannot exploit what's in the electronic health record to do basic things like care planning and to have alerts and reminders of things that are overdue. We have to know what we mean by certain data structures and phrases.
Vienna is a very historical city that, I think it was inhabited over 200,000 years ago. So it's very ironic that I'm speaking about Dubai and the United Arab Emirates, a country which is only 36 years old. So we are very proud of our achievements, clearly, in a short time, but we couldn't have reached where we are today without the help of the entire world and without what we've learned from people across the world that have had major impacts on reducing morbidity and mortality and improving the lives of people. So.
Austria is already a leading country in e-health because we are one of the very few countries in Europe, at least, which has a working healthcare system. All the 8 million inhabitants of our country already have an electronic health card, and we already have a network of almost 11,000 healthcare providers which are linked to this system. So we do have a basic system which is allowing us now lots of new applications in the e-health sector. What's the one reason. The second reason is that we are really working hard on a nationwide electronic health record system, which will allow to participate all the healthcare providers, hospitals, and outpatients organizations, and each and every citizens in this country. And we are progressing in this work very well. We have a lot of political commitment behind that. So we are also, Austria is a showcase actually in the new development of e-health.
Healthcare solutions for a better tomorrow is all the time a tricky topic. And but let's get to somebody who is clarifying and telling us in fact about its technology and the services that they are able to provide the patient. Especially they are focused in Austria, but let me get something if they have any chapter in Asia as well. Please.
Well, we've done an analysis of the healthcare systems around the world, where we have made some conclusions that really shows that if nothing is dramatically done, we will see a more or less a meltdown of the healthcare systems around the world.
What is now the association of IBM and this technology service that you are giving to the patients? So what category of the patients should get happy with this?
Well, we are focusing on different areas. We are focusing on, providing solutions that helps the physicians make better decisions on the treatment of the patients. This is creating what we call patient-centric networks that really bridges the different islands of information that exists in the healthcare system today. We have new technologies like we show on this side RFID for tracking that really supports the improvement of quality in the healthcare system, where you really all the time have a very close connection between the patient and the medication. We also have advanced decision support solutions that helps the doctor take better decisions with the emerging new technologies, the Human Genomic Project you have probably heard about. It is totally impossible for a physician to look through all these different types of information.
So what is new now? What is new? It is already done. Is it a kind of a new innovation or a kind of
there are different directions. We've seen. I'm from Denmark, where we are on a global scale. We are pretty advanced. We do have what I call a patient-centric network, that is the public national health portal of Denmark, where we are really putting all the information around disease management into one access point, where the professionals as well as the patient can access this information.
We're running out of time. Just the last. Does it save life or time? Or
well,
money?
It definitely saves lives.
It's very. Where? In Asia, in Europe?
It saves lives everywhere. In United States alone, the estimate is that what equals to a jumbo jet crash every day is patients dying because of wrong medication.
Can you name me any Asian countries using this facility?
Any Asian countries? No, not right now.
Now, the tool that is being promoted most strongly as a tool to help in this space is known as an archetype, a clinical archetype or an EHR archetype. And this is something which was pioneered by the Open EHR Foundation, but is now also in Part 2 of EN 13606, a full European standard. So this is no longer at the invention place. This is now a European standard, a de facto way of representing information that defines clinical data structures within an electronic health record.
internet penetration في الإمارات in the UAE is very, very high. It's very, very high. So,
especially in healthcare sector.
Well, people don't generally use information for healthcare other than to find out about their diseases. يعني they use websites like WebMD. اللي عنده صداع مثلا يروح يشوف في الإنترنت شو سبب ممكن يكون أسباب الصداع etc. بس in the Arab world, I think in general, not just in the UAE, people don't generally use healthcare for IT purposes. IT for healthcare purposes at this stage. But I'm sure this will change as more and more people use IT in general. So, I mean, who would have thought that, the young generation of today are very electronically, savvy. They use the internet and they use IT systems very, very easily. The cell phone is a very, very important part of life in the Middle East in general. I know it is in the UAE, text messaging, Blackberries. So people are into technology. If the platforms were introduced, the platforms don't exist today, but I think if they were introduced in the Arab world, it would be received well.
Okay, my name's Chip Means. I'm the web editor for Healthcare IT News EU, and we're the publishers of Healthcare IT News in the States, and we're here both working as journalists for the conference and presenting our website and e-newsletter to the healthcare IT providers in the EU space.
What are your expectations from the people who are using your website?
We expect that they find it very comprehensive and that it covers a lot of the EMEA region and has a provider focus and a vendor involvement as well.
And the challenges that you are facing day by day?
Well, the challenges are for us, being a U.S. company moving into this into the EU to do the journalism, but we're hiring writers in Europe, and we're using all of our experience and knowledge from the Healthcare IT News publication to.
How many languages do you have?
Personally, I speak English and have some Spanish, and Jack, our editorial director, has some French. We're covering our news currently. It's only written in English, but we have. The ability, we have translation resources, and we have a writer in Germany and a writer in France as well. So we're hoping to increase that and get someone who speaks Italian as well, and eventually go.
Is it free of charge, or do you charge the people for
the website it's free access. There's no login, and the e-newsletter is a free subscription.
Do you have any intention for Middle East or in Asia to have some translation in Arabic or any other language, or it is?
Well, eventually, as we expand the scope of EMEA and really take it from EU to EMEA, that's a possibility for us.
And what do you feel this conference would bring something new, or from your perspective, something?
Well, this conference we're hoping to increase our exposure and get a lot of people to recognize the publication and sign up for the newsletters, and we're hoping to cover all the major events and news from the conference.
Thank you very much.
Thank you.
Thank you.
Hi, Ceres is about Ceres International. We're a UK-based company. We've been going for about 16 years, and basically what we do is we do social health care, covering sort of palliative care, community hospitals, outreaches, as well as drug and alcohol abuse centres. And what our system does is basically integrate one business application to cover the care, the support. Yeah. Well, basically what we've won a couple of awards. We've won the Foster and Sullivan Initiative European Award. We won that last month in regards to our system that's based out today. So, and we've also won the Taiwanese Award, basically for an initiative, again, for a single system.
And what is your expectation from this symposium?
Just to see, it's the first time we've been here, so it's just to see how we get on and basically see if we can get any clients from it.
The challenges for getting these, reaching to that position to be given any kind of global awards, what are those challenges? What are those steps?
Our challenge is we've got a multifaceted system that can be multilingual. So basically it covers right across the world. We've gone into China and we thought we'd try the European market now. So that's basically why we're here.
Thank you.
Yeah, thank you.
EUREREC today is involved in a number of European-funded projects. It's coordinating QREC, the one dealing with certification, but it is also partner in other projects such as EHR Implement, which is dealing with organizational, legal, social, ethical issues when implementing at national levels EHR systems, and RIDE was dealing with semantic interoperability.
Name, but those switches, yes, years ago when the company was founded, everybody called something about global switch, global traffic, global, so on. So, but in the meantime, our company just plans, builds, and provides data centers, big data centers. So the smallest data center we got in our group is about 10,000 square meters, and the biggest one is in London. We got 66,000 square meters data center space. And the reason why we are here is just to bring new solutions for the hospitals, because the IT in hospitals, that's not the core competence. Now the question is where the IT, which is more and more complex, where they could bring it out. Just the hardware to stand in a secure environment like we provide. So the hospital is able to move the whole IT, her equipment, on our sites. We just care about power security, the UPS, cooling, and security issues. So they just can totally care about
Can you name any hospital?
That's a little bit.
Any hospital that you have provided this service?
We are not able to talk about the hospital because that's a data issue, but we can call out who we are working with, and that's Agfa Healthcare. So Agfa Healthcare is also a customer of us, and they provide the hospitals. And so they bring the hospitals to us on the side. They care about the hospital's IT, and we care about the security of the equipment on our side.
So it sounds that you do not have anything new, fresh, brand new here today to offer. This is something which is used, just you are using the opportunity to offer these services, in fact, to those who are not aware of it.
I think it is new. Not the data center is new, but it's new for this channel, for this sector, healthcare. Because you know that the data from patients are very, has to be protected, secure. And it was a big discussion also with our lawyers how to bring out the patient data from the hospital to another space. And the doctors and all the employment of a hospital are a little bit scared what is happening with the data of a patient. So, so it's new for us in Germany also just to care about the IT separated from the hospital. So they got a special line to us in the data center to protect the data that nobody can grab it. And so it is in the combination, it's new.
And the challenges that you are facing with the service you're providing?
Our service is cooling, power, and security.
No challenge at all?
No challenge? Why should it be a challenge?
I'm asking if there would be any challenge that at least you are trying at least to use this microphone, at least give the message, these are disturbing you, these are not disturbing you, you are completely satisfied with your clients and customers, that's it.
Yeah, for sure. Yeah, we're really satisfied. Also with the cooperation with Agfa.
Are not doubting you because of...
No.
Okay.
See, the Austrian government is always very involved in bilateral and multilateral work. You know, we are strongly supporting the work of the European Union, the European Commission, and the European Union in general in e-health developments, and we are also involved in the developments which are going on the grounds of the WHO. But we are stressing more, the more important for us is the development within the European Union, Austria is also participating in a large-scale pilot, which is starting now, to find out more about the interoperability of e-health systems within the European Union.
There's a lot of effort that goes into that, and we have numerous bodies that specifically focus on bringing conferences and events to Dubai, some of them being health, and we work very closely with those bodies. The Dubai International Trade Center, as an example, we work closely with them. We are the major sponsors of Arab Health, and Arab Health has now become one of the largest health conferences in the world. I mean, it's now larger than Medica even. So Arab Health is a major event that happens through the year. We also host numerous events in Dubai that Dubai Healthcare City sponsors or is involved with throughout the year.
They're very happy with us and our services, yes.
Decides on the software they're going to use and the type of hardware they're going to use on the IT, they have to integrate all that equipment into the clinical area, and that's GCX's specialty. We mount the vast majority of patient monitoring systems worldwide, and along with that expertise is the ability to mount IT hardware and integrate it into the operating room, the intensive care unit, emergency room, everywhere in the hospital. So we're sort of the anti-gravity part of the equation. So we're at the end of everybody's rainbow. Eventually you have to integrate the equipment so the users can use it, and that's what we do.
So it is not doing now, or it is quite new? What were you doing before?
Well, we've always done mounting. We've been mounting patient monitoring systems and medical devices for over 35 years, and we've just extended that expertise into the IT world as the need for electronic patient records has grown worldwide. So as GCX changed and modified its product line and applied its expertise to help doctors and nurses integrate this equipment into this very, very tight environment.
And as I read they're serving Europe from Europe, it means you are just focusing in Europe.
No, we're actually a U.S.-based company, but we work worldwide.
Worldwide, can you name any Asian country?
Well, certainly we work in India and throughout the Far East Asia and Japan and China and Taiwan and Singapore, you name it. Because we serve companies like Philips and General Electric, who are multinational companies, and a host of smaller patient monitoring and medical device companies. So it's a very niche market, but we're a very large player within that niche.
Sampling, who should get a copy with this? This
well,
system would help the patient, or just help the administration?
What it does is it helps the people that actually have to use IT in healthcare. It actually gets their equipment so that they can access it. So it's one thing to have to choose some software, which many companies provide, and choose a PC or a laptop. But eventually, you've got to have it integrated into that environment, and that's what we do, and that's what we help them do.
Is it very costly?
I wouldn't say it's costly. It's only costly if you don't remember it. In other words, in the process of planning to integrate IT, mounting is important. It's not an inexpensive. It's not expensive. It's a necessity. Everybody needs to do it at some point in the process.
And the last, what are the challenges that you are suffering with?
Challenges we're suffering. Well, I think the biggest challenge is to keep up with users, because IT hardware constantly is changing. Not everybody wants to use the same combination of IT hardware. So it's our job to stay ahead of the market and understand what hardware they might use, if it's different types of flat panels or flat panel PCs or separate CPUs or different size laptops, because laptops are getting bigger again. And it's our job to stay ahead of that particular part of the market so that we can offer solutions to help them mount it once they need to use it.
Thank you very much for the moment. We'll get back to you later.
Thanks.
Here today, using the advanced functionalities of MetaVision to improve patient safety, reduce costs, support billing, improve the outcome of the patient, and of course to facilitate research, and then give you a short summary. So let's start. What's the problem today in critical care? We have patients that become more and more sick, we have a lack in resources, and we have less time for every patient to treat him. What possibilities do we have to cover those areas? We can use a standardization, we can try to improve quality, and we can improve the quality of treating patients throughout different departments. That means from the OR to the ICU, to the intermediate care, to the recovery room.
Do you feel good being in Vienna, in fact, and having this conference in Vienna? Were you expecting that in Rome?
Yeah, Rome it's better, but
because of your hometown.
Because I came from Rome.
And you do not see any kind of any connections between this conference and Vienna? You think that this is just done for publicity, or Vienna can be a role model for medical science?
No, I'm not sure that Vienna is the center of the.
What we do have, if we cross borders, and even if we cross borders within our own country, from one province to another, we have to make sure that the different IT systems in hospitals or in outpatient organization or within the social security system is interoperable. And so we have to define common standards in identification, in technical standard frameworks, and in the building of registries to find the information we need, to locate the information we need. So we have to work on common standards in Europe and worldwide, but first of all we have to do that within the European Union, of course, because the mobility of patients is becoming more and more important. And so we have to make our systems interchangeable.
And do you think that this conference is a successful conference and Vienna can be a role model to host such kind of conferences?
Yes, that's right. Because you see people coming here from all over the world and they are more relaxed instead of if they are at home they have to deal with the mail and all the things. So that's the reason why we are here.
You mean Austria can be a role model because of the healthcare system or just because of the geographical situation?
Could be, since they have the reputation to be able to organize events like this.
And do you know something about Austrian healthcare system? Where is it?
A little bit. I know that if we see from at least what we have in Scandinavia, we have a lot of things that we can learn down here in Austria within the telemedicine area.
Thank you very much.
Thank you.
I would like to know, why are you here?
I'm here representing a technology company that provides solutions for healthcare. We effectively enable organisations to effectively manage their electronic patient record. So we take the paper part of their record and make it available as part of the treatment that they receive, irrespective of where they are. So I'm here to promote our software.
And where do you come from?
Right now I live in the UK, but originally my family's from Pakistan.
And from a Pakistani perspective, what would you expect from such kind of conferences?
Well, I think the quality of the delegates here is actually quite high. I think we've had some good opening session this morning from Dubai Health. I think that was a very, very good session. I think it's a little bit cold, I would say.
And do you think that the implementation of such kind of conferences, would it be possible in Pakistan easily, or is this very high?
I think in order to get the level of delegates, you would need to work very hard to host it in Pakistan. However, for the region, you could probably attract some good quality delegates. But from Europe, I think it's very difficult to get people there from Pakistan.
And do you accept Austria as a role model?
As a role model?
In World Health?
I think that's a difficult one to answer. I'm part of the UK. We're going through a major program at the moment in the UK. In terms of Austria's healthcare, I'm here to learn, find out as much as I can about it.
So you admit that Austria can be a role model for the entire European Union?
I wouldn't say that. They're your words, not mine.
Thank you.
All the surveys we conduct in that field tell us that the people, that our populace is very eager to participate because they intuitively notice the big advantage of having health data available, time without any time, and independent from the location where you are right now.
Problem, they're not getting their internet connection.
Management dort mit der Auswertung und Verarbeitung der Daten, sondern auch auf den Critical Care, wie es heißen. Und eines der Systeme, das Sie hier sehen, heißt IntelliView Clinical Information Portfolio for Critical Care. Ist ein System für den Critical Care Bereich, deckt alle Einheiten ab von Acute Care über Intermediate Care oder auch General Ward bis hinab zu den Intensivstationen und auch ED Department. Also ein flexibles System, das Sie frei konfigurieren können für Ihr System, für Ihr Krankenhaus, wo Sie die ganze Flexibilität haben, Ihren Workflow abzubilden. Wir haben integrierten Datenmanagement und das Wichtigste dabei ist noch, dass Sie auch sogenannte Clinical Advisories bekommen. Das heißt, ein System für den Clinical Decision Support, mit dem Sie Regeln aufsetzen können, wo Sie frühzeitig alarmiert werden, dass mit Ihrem Patienten möglicherweise etwas im Entstehen ist, zum Beispiel eine Sepsis, wo Sie dann durch ein Sepsis-Protokoll geführt werden, um hiermit Ihre gesamte klinische Dokumentation durchführen zu können.
Danke schön. Danke vielmals.
Welcome.
Tell me something about your country, about Jordan.
Jordan is
about the healthcare.
About the healthcare. The Jordan government looking for implementing an e-health solution to connect all the healthcare sector, the army sector, and the Ministry of Health sector to have one medical record around the Jordan.
We are making progress in Austria. We once again we were able to implement our electronic health card system within very few years, and we are really on the forefront of this development. But see, this is we're all talking now about the interconnections of different healthcare providing systems. Within our hospital systems in Austria, we have a long-standing tradition of hospital information systems. We already have cores of telemedicine applications working, so that if you go deeper and look closer to our hospital systems or in single hospitals, you will find lots of applications, e-health applications already.
Right. Health languages today in clinical and administrative parts of healthcare, there's so many codes. There is ICD-10, ICD-9, CPT, OPCS. There are codes, and what do they mean and how they relate? And how does an information system take those codes and make use of them and enable transition of those codes across international boundaries? So we're about interoperability. We're about the ability to map content and help facilitate the use of content within applications.
And does it save money?
Absolutely. It's money and time. I mean, time is money, so it definitely saves lives. Absolutely. I mean, today the ability to have clinical information, the actual coded correctness for pharmaceuticals or for certain conditions of a patient. Computers can't work on text alone. If you put text into a computer, it doesn't know how to deal with it. But as you put structured data into a computer, it can then start to use rules to help decide, is this is this medicine good for this patient in this situation? Yes or no. Well, we provide that content, those for the structured tools that then rules can be written against.
Can you name any company, any hospital uses your services?
In many of them in the States. In Europe today, no, not today, other than the UK. In the UK, we have hospitals that are starting to use our tools and our content with a part of the national program, you know, that's going on there, Connecting for Health.
Thank you very much.
Yes.
Specialist that provides core specialty areas. That's all within the first phase of Dubai Healthcare City. Phase 1 of the medical community will have, when it's completed by the year 2010, it'll be completely built. Now 70% of it has been already built. We have the Arazi Medical Complex, which is 4 buildings that have over 100 healthcare facilities within them. These are day surgery centers where patients can come in for specific surgery, eye surgery, laparoscopic surgery, minimally invasive kind of procedures, as well as a whole range of multi-specialty clinics. We also have numerous other facilities within Dubai Healthcare City. Like I said, that's the medical community, or the core, the cluster of the medical community, the heart of which is the teaching hospital, a 400-bed teaching hospital, the Harvard Medical School Dubai Center, which is a center for postgraduate medical education, and then we have a foundation, a research foundation, aimed at training people from the region to come back and then do research on diseases that are prevalent in the region, like diabetes, as an example, and cardiovascular diseases. That's phase 1. Phase 2 of our project, which is about 3 kilometers away from phase 1, is what we call the wellness community. The wellness community is focused on alternative medicine and complementary medicine services. It has environments where people can go and get checkups, and these are people who are well or recuperate after illness. We have rehab facilities, long-term care facilities for both adults and children in the second phase of Dubai Healthcare City, as well as huge residential and healthy living kind of area.
I think Austria can be a role model for e-health developments, and we also can be a role model in empowering patients and health providers to get the right access and to immediate access to information and knowledge. I think e-health, as we understand it in our Ministry of Health in Austria, is a wonderful tool to get access to information and knowledge in the healthcare sector.
So the message is that we continue to learn from the world and try and refine it and work on it and put a Dubai label or a UAE label on it and move it on.
Great.
Thank you.